Thank you so much, Julio and Elizabeth, and good afternoon, everyone. Thank you so much for joining us today. And special thanks to Amy Gitson, who's not here with us, and Julio Garcia from the National Scleroderma Foundation Tri-State Chapter for inviting us to speak, and to excuse me, Elizabeth Soto Cardona from the Hospital for Special Surgery SVM Center for moderating today's discussion and for that wonderful introduction. As Elizabeth shared, my name is Mary Rose Carey, and I'm the social work manager for rheumatology at Hospital for Special Surgery. With me is Batiste Nicholas, the rheumatology clinical social worker. We're very happy to be here with you today and share our presentation titled Your Voice Counts, How Improving Patient-Provider Communication Can Improve Health Outcomes. Our hope is that we're able to share some valuable information, but also that you're all able to connect with each other on your own experiences. We're happy to have you ask questions or share thoughts via the chat box throughout the presentation, and hope that you'll be able to gain some knowledge and resources from your fellow attendees. And as Elizabeth said, we will have time for a formal question and answer at the end. I also want to say before we start that you'll be hearing the words patient and provider a lot today, pretty continuously, but this is really much more about the communication between two people with identities that far exceed just those roles. Next slide, please.
Hi, everyone. Good afternoon. My name is Batiste Nicholas, and I'm very happy to be here. It's a very interesting topic that I look forward to discussing today. So not only is the doctor-patient relationship important, it's one that all of us are in now or will be in at some point in our lives. So it's important to think and discuss how to navigate these relationships in all their complexities. And as Mary Rose said, we'd like to, this is a discussion. Sorry, we'd love to this be a discussion, but we will have some learning goals as well. So the learning goals for today are discussing your shared experience with patient-provider communication. And since you are the ones that you know your experience best, it would be great to hear how you interact with providers and any success or challenges that you might have, as well as any suggestions that you might have for how things that have worked to improve patient-provider communication in the past. And we'll also be discussing ways to identify barriers to and challenges with helpful patient-provider communications, practical tips for establishing good communication with your provider, and finally, we will be going over how improvement in communication can benefit your health. In the past, patient-provider communication was seen through a hierarchical lens, meaning that the doctor was in charge. And now we try to see it through the shared decision-making lens. This means, and rightfully so, they should have equal say and input when making medical decisions about your own care. And we hope to highlight ways to work towards this today. Next slide. So now, more often than not, communication is not perfect, right? There is good, bad, and hopefully not too much ugly, but we know that's there. And while we will be discussing preferred and desired outcomes today, we also want to be realistic and discuss the negatives as well. This gives us a framework for areas of improvement. A study that on patient-provider communication was done, and participants were asked to identify what they saw as positive and negative results. Among the top successful outcomes of positive communication were, I was listened to, my questions were answered, I was taken seriously, I was given necessary information about my health. And on the flip side, some of the more common negative remarks were, I felt interrupted, I felt unheard, I wasn't taken seriously, and I still don't know what is wrong with me. And as you might see, there's a stark contrast between positive and negative outcomes. And we bring these up because it's important to be aware of what to look out for when visiting with a provider. If the visit goes well and you feel a strong connection with the provider, that's great, right? That's what we all want. But there are times after a visit with a provider where we might feel frustrated, but may not know exactly why. It's important to be aware of these feelings that you might be experiencing, so you could take note of it and discuss it with the doctor in real time or during a follow-up call or another appointment at a future time. I would encourage you to pay attention to these feelings during your next appointment. Later, we'll discuss how you might be able to address some of these negative feelings or outcomes with your provider. Next slide.
So I'll get started on the slide in a minute, but I'd love to hear from you first, or see what you want to type first if anyone is comfortable sharing. What does good communication look like to you? What does it feel like? If anyone has any thoughts, feel free to unmute yourself or just write something in the chat. But it's not a quiz, so you don't have to.
Hi, this is Latanya with Marlene's Kaleidoscope. One thing is you walk out of the visit with your doctor feeling like you accomplished something, that you partner with your doctor heard you and you heard your doctor, which is two different things.
Absolutely, absolutely. I think that's so true, and I think acknowledging that they're two different things are so true, and they are equally important, right? We have to have both sides of that that conversation to make it really work. Thank you for sharing that. And I see in the chat, to be acknowledged and listened to. Absolutely, absolutely. I think we all hopefully are familiar with having that kind of positive feeling when we step out of the appointment room. And that's really what research shows as well. We see that increased satisfaction communicating with your provider happens when the following things are present. Providers are warm, reassuring, approachable, supportive, and friendly. You might say human, right? You want to feel comfortable with your provider and have an open and honest interaction. You want your doctor to see you as a person, right? Not just a diagnosis, not just symptoms that they're treating, but a real person. And their support will make you feel relief just by having that support and validation. You want your doctor to present as knowledgeable and really share information, not to seem uncertain, but to really show confidence. If the provider doesn't present this way, how are you supposed to feel confident with their recommendations, right? Now we want the appointment to be focused on you, right? The patient's concerns, what's happening for you. You really want the doctor to seem and to genuinely care about you and respect you. It's a major determinant in patient satisfaction. And finally, I think as you put so nicely, you want to feel as if you accomplished something, that all your important needs were shared and that you were really heard. So why is patient satisfaction so important, right? We talk about it a lot. Now, your satisfaction directly affects the decisions you make, and those decisions affect your healthcare outcomes. Studies on patient-provider communication in rheumatology specifically found that higher levels of active patient participation and engagement in the medical consultation were linked to lower disease activity, greater satisfaction with fewer side effects from medications, and more positive beliefs about your ability to control your disease and about your current and future health. These are big, important aspects of your care. Next slide, please. So, we've established that good communication is important and what it might look like and what it might feel like, but we never said that it was easy, right? This can take a lot of work. And what might make it hard? Does anyone feel comfortable sharing something about that? What makes these conversations and these interactions a little bit more difficult? Oh, this is a good one I see in the chat. Okay. When a provider has a preconceived notion about you as a chronic patient, they've already made up their mind about what you're experiencing and what illnesses you may not have. They're not interested in listening to what you have to say at all. Absolutely, right? I think there's an element in that statement, and thank you for sharing that. There's an element in that statement of maybe the doctor not seeing you as a whole person, right? We've mentioned that once, and we'll certainly mention it again, but feeling like you're walking into the room and all they care about is your diagnosis, right? And the diagnosis is just such a small piece of who you are. So certainly that could absolutely be a barrier to good communication. Thank you very much for sharing that. And truthfully, many things, both big and small, can contribute to challenges for communication. with communication rather. Maybe you're not comfortable with your provider. Maybe you haven't had time to form a relationship yet. We all know doctor's visits can be very short. Your time with the physician is really, really limited. You might be embarrassed about your symptoms, or you might not be sure how to describe exactly how you're feeling. That's really common. Certainly, cultural considerations can come into play, especially if you're not used to being asked about certain health concerns or sharing those. There could be a certain ingrained level of discomfort. And it can also be really challenging to communicate with your doctor and form a good relationship if you've had a past history of frustrating or negative experiences with your health and healthcare providers, and even more so if you've experienced bias or discrimination in a healthcare setting. Next slide, please. So, discrimination and bias, even the perception of this, has a real and really, really negative effect on the patient-provider relationship. And this, in turn, as we discussed, has a negative effect on communication and subsequently on health outcomes. If you're experiencing discrimination or bias in your healthcare setting, it's really important to connect with other people, either family or loved ones or clinical support staff, such as social workers, to help you voice your concerns and navigate this. Not only do we know that the experience of discrimination and bias can have a really damaging impact on your health, but no one should feel mistreated or unheard. Next slide, please.
Thank you, Mary Rose. So with all that, what can be helpful, right? It's one thing is it's completely okay to let your provider know what your experiences are. And I understand that at times there might be a hesitancy to speak up. It's not always the easiest thing to do with the provider, but each person's experience is unique, and being able to discuss your experiences and how they affected your life can be very empowering. Something else that is helpful is to discuss with your provider's office any support services that might be available. This could look such as social work services, which Mary Rose mentioned, that it can assist with access to care. Some of these barriers are transportation services, prescription assistance programs, mental health referrals, insurance inquiries, and etc. And it's important to know that your health doesn't necessarily start and end with your provider. While your doctor is a point person for your care, there are other helpful resources that make up your healthcare team. And another important tool that could be helpful is access to interpreter services. If English is not your primary language, or you don't feel comfortable communicating in English, access to interpreter services are your right. We use them all the time here at the hospital, and it's very useful. This is your health, right? So you are the one discussing, and being able to discuss in a language that is most comfortable for you is your right. Next slide. And another important step to take is to be direct with your provider if you feel like you're experiencing bias or discrimination. And I 100% know, again, that this can be uncomfortable, and it's not an easy topic to broach at any time. However, it is really important to let your doctor know how their actions and behaviors are impacting you. They may not realize that this is occurring, and being vocal will hopefully lead them to better understand how they are affecting you. If you do not feel comfortable communicating directly to the provider, that's okay too. You can discuss with members of your care team, such as a social worker or nurse, for additional support. I often work with, there's times where patients will reach out not feeling comfortable about a provider, and we can help kind of facilitate any communication. And by advocating for yourself, you will be sharing your values, beliefs, and preferences, which also helps to promote the shared decision-making that we discussed earlier. You're the most important part of your own treatment plan, and your voice should be given equal weight. Another tool that we find useful is the Ask Me 3, which Mary Rose will discuss.
So this is an infographic showing Ask Me 3. It's a really simple concept that helps set you up for a more informative and productive conversation with your doctor. when time is of the essence, and we know it usually is, and you need to really get to the point. These 3 questions can lead to a lot of useful information. The 3 questions are: what is my main problem? What do I need to do? And why is it important for me to do this? It's really key to understand the reasoning behind recommendations from your provider, not just to hear what they'd like you to do. We all know that doctors' visits can feel really short, because they are really short, and this can help you narrow down the focus of the visit to get the information that you need. Next slide, please.
And here are some additional tips that can be useful. So this has happened to me before. You could be in the exam room and your brain is going 100 miles a minute, and we might forget kind of some of the things that we wanted to discuss or what's being told or discussed with us. So making a list of questions prior to the appointment can be a very useful tool, and it'll help you feel a bit more organized. While we might have many things that we want to discuss, I would encourage you to keep your list of concerns to about 1 to 3 topics. Research has shown that patients who present with an extensive list might not get all of their concerns addressed in one exam and might be left feeling frustrated. Unfortunately, we know that time with your provider is really limited, so focusing on your most pressing concerns will help ensure those are addressed. And sometimes speaking about health concerns can be uncomfortable, but I would encourage you to try not to be shy. The conversation is a two-way street, and you should be a big part of it. This includes asking to slow it down if too much information is being thrown at you too quickly, and also asking for definitions if your doctor is describing something in a way that you don't understand. Another helpful tool, if possible, is to have someone accompany you to your appointments who could be another set of ears. I find that we can forget what was discussed during a visit, as many things can happen fast. Bringing someone to your appointment can help make you feel more comfortable in communicating with a provider, and allows for someone to debrief with after the appointment and to make sure that you didn't miss anything. And at the end of the appointment, I would also encourage you to ask the provider for a recap and for you to verbalize back to the provider. This will allow you to retain the information more easily, and you can also take notes during, whether on pen or paper or phone or tablet. And lastly, if your provider uses electronic messaging, this can be a very useful tool. Next slide. So communicating with providers via electronic messaging has shown to reduce symptoms of those with chronic illness and keeps you engaged in managing your health on an ongoing basis. As opposed to being limited only to exam or appointment times, which can feel very rushed, I highly encourage you to look into whether this is something your provider's office uses. We are all too familiar with placing phone calls to the office and leaving a message and hoping someone calls you back, which can be very challenging and frustrating. Using electronic messaging helps streamline this communication. It allows you to follow up with questions that you may have forgotten to ask or did not think of during your exam, and this way you don't have to wait till the next time. And the use of these patient portals can be an effective way of increasing your own self-management skills and self-efficacy in navigating your illness. And if you're having difficulty utilizing a computer or phone, or don't feel comfortable, you can ask a friend or family member to assist in your communication through the portal. And if this is impossible, completely okay. I would also encourage you to discuss access to the system with your provider's office. Very often, if electronic messaging is something that your doctor's office uses, someone will be able to assist you in enrolling and understanding the system. And it's also important to inquire about policies for utilizing messages, so you kind of understand what to expect, such as how long you might expect to wait for responses. And just one caveat is that your written communication is likely to mirror your in-person communication. So it's important to establish a positive relationship regardless of the method of communication plan you used. Next slide.
So before I move on to this slide, I do want to address something that was said in the comments, because I think it's really important and it goes along with what Batish just said. in terms of understanding what to expect from your provider's office. So it's a shame that some practices are starting to bill for using electronic patient messaging. This may decrease the likelihood of patients using this as a mechanism of communication. Absolutely agree that it might decrease likelihood, and certainly you want to check with your doctor's office to understand their policies around that. You don't want any surprises. It is such a useful tool. And certainly you want to be aware before you start using it a lot what their billing policy is regarding to that. So thank you so much for bringing that to our attention. And I agree that could be a barrier to using this really, really valuable method of communication. So in earlier slides, we outlined a lot of ways in which you can navigate communication issues, but sometimes it's really just too much to do on your own, even with the support of family or loved ones. And that's where social workers can help. We can support you in some of the following ways. Advocacy, which means speaking on your behalf, but also empowering you to tackle those tough conversations. We also ensure that your language needs, whether translation or interpretation, are met. We can be a mediating presence for conflict, helping to navigate the difficult or confusing or, ugly conversations to ensure that everyone is on the same page. We're also here to provide education to you, certainly, but also to your provider. We want to help shed light on you as a whole person, your whole story, which in turn will hopefully help the doctor treat you as a whole patient, as a whole person, rather than just focusing on your diagnosis, because we know all of your identities are really important to understand when you're coming into a treatment space. I want to add, these things aren't the easy perfect fix, right? And there's not necessarily one big secret to enhancing and creating perfect communication, but all of these are things that can help support you on the road there. Next slide, please.
But why does good communication matter, and why is it so important? I was doing some research and I came across a study that put it this way, which I found was very powerful. Talk is the main ingredient in medical care and is the fundamental instrument by which the doctor-patient relationship is crafted and by which therapeutic goals are achieved. So promoting the exchange of information between the patient and the doctor is important, as information is a resource for both parties. Doctors need information to establish the right diagnosis and treatment, and patients need information to know and understand what the problem is, where's the pain coming from, and so on, as well as the need to know and feel understood. You want to know that your doctor accepts and takes responsibility for your care. And as I discussed before, traditionally the doctor-patient relationship was paternalistic, with the physician kind of running the show. However, over the past 2 decades, like we discussed, there's been that shift towards shared decision-making. And in order for you to actively participate in these decisions about your health, you need the information, and that goes right back to communication. So satisfaction with communication is crucial. It makes it more likely that a patient is able to follow the agreed upon treatment plan, which leads directly to better outcomes. Satisfaction is a good outcome in its own right. It feels good to be pleased with how you're communicating with your provider and vice versa. Also, satisfaction with communication is a necessary first step for improved outcomes in other areas such as recall and understanding, which are both very important. Next slide, please. And furthermore, some research has indicated that feeling satisfied with your interaction with your doctor can improve how not only you feel, but also how you measure physically. So both mental and physical improved outcomes. Additionally, it is very powerful simply to be heard, to have your concerns validated, and to feel as if your doctor is listening to you, and to feel like a partner in the conversation, planning, and treatment decisions.
So I want to wrap up today by sharing a story in the own words of one of our patients who Batiste worked with earlier this year. She wrote, "When I first came to HSS, I could hardly walk and was literally in tears. I could hardly move my arms, and I had an infant to care for that needed constant lifting and attention. My nature was to be full of energy and keep pushing forward, but it was becoming impossible. Dr. S was so thorough and really took the time to figure out exactly what was going on in my body and set out an action plan that had me walking and full of energy again very soon after my first visit. Social worker Batiste Nicholas also went above and beyond by explaining services that were available to me that I had no idea existed. Both Dr. S and Batiste have always been available for my questions and concerns, even between appointments. Dr. Siegel is an incredible doctor. I can dance down the street with my kids again, and to HSS, I owe this joy. So I think this patient's words truly highlight the real strengths of good communication and shared decision making. This goes beyond statistics and tips and shows why all of this really matters and what it meant to this patient in terms of not only her health outcomes, which were excellent, but her real life, her personal life. The relationship between a doctor and a patient is what happens in the exam room, certainly, but it's also what happens in the real world outside that exam room. There's a lot of power in that relationship and in that communication. And if you and your provider and the whole clinical team can work together on establishing a solid rapport and that great communication, it really can contribute to a positive outcome. Next slide, please. So that is actually it for us in terms of content. So I'll stop the recording now and we can go ahead and do question and answer, as well as anything you want to share.